Great. Well, let's go ahead and get started. And thanks everybody for joining today. I have to say just a quick note that this is, I think, a really tragic day in world history with what is going on in Ukraine. And I think, I know we're all watching with concern, but it's sort of occupying many of my minutes of thinking and read about now the Chernobyl region is under attack. I was there probably 12 years ago visiting that plant. And, of course, that part of the world was reemerging from the Soviet era at the time, and Kyiv was a vibrant city and became more vibrant. So I think this is a terrible moment, and one that I just feel we all have to acknowledge. Turning then, I want you to know we could play a guessing game as to where I am standing for those of you who have not been in the Fitzsimmons building for a while, but here are the elevators to the third floor as a reminder. And you haven't met Austin and Bobby. Here's Austin holding the official coffee cup mug, and Bobby, who you haven't met, and just to see work that we did a while back. You may or may not like it, but Christine and I worked hard with a number of you to recarpet the third floor. I think we've had it, Christine, about 9 months now, roughly. And so things look a little brighter up here, and some of my favorite coffee stains and pen stains are gone. So we hope you all come back and enjoy this environment. So what we're going to do today is spend a little time. I'm going to give an update on where the pandemic is in Colorado, talk a little bit about where we are, and I'm going to demask and talk a little bit about where we are. We're going to hear from Kevin and Christine about return to work questions and issues, reminder on our remote work agreements. Chris Jones is going to speak from the staff council. We have a number of our leaders, unit leaders here to help answer your questions. And with that, I'm going to go ahead and get started with this quick update, and just give me a moment to, oops, sorry, I ended up with the wrong thing here. Let me get the right presentation. Should be town hall. Are you seeing town hall, or are you seeing something else?
We're seeing the immunity versus Omicron infection.
Okay, good. Okay, got it. Okay, yeah, something was wrong showing up in mine. Okay, great. So it just is a background for everybody, and at last, in terms of where the pandemic has been, the modeling efforts, we've been able to show good news. This is sort of our agenda. We have till 1 o'clock if needed. We want to make sure that we have a full discussion of coming back onto the campus. I think no one needs a reminder that we are at a good point with the pandemic. This is the national data, and we have the Delta surge, and then of course the rise of the Omicron variant, and it's fall in most of the country. There's still some hot spots, but Colorado, we have a patchwork of how we're doing, but we're doing very well as a state, as you will see. So turning for a quick look to Colorado, we have here the case numbers, which have fallen greatly. We have deaths. Unfortunately, I think the state is at around 12,000 deaths over the course of the pandemic, a shockingly high number, but fortunately dropping. There's some delay here. For the modeling efforts, we follow the number of people hospitalized with COVID-19 confirmed very closely. And if you look, there's the Delta peak back in November. The Omicron peak that followed. The highest number of people in the hospital was around 1,676 in January, mid-January. And that number yesterday was 415. So we've fallen to a quarter of the peak now, and every projection shows that we will continue to fall and should get down to prior low levels. You know, for example, back in the summer of 2020, when we were at our lowest. Our worst, we had almost 1,900 people in the hospital. And of course, a goal of public health at the state and local level is to make sure that this number did not get so high that we wouldn't be able to provide care for everyone. And luckily, we have not done that, although there have been some worrisome times in parts of the states and for some of our institutions. Another indicator is the test positivity for specimens that are collected. We'd like to see that low, below 5% for sure. With Omicron, the infection was really common. You can see that the percent positivity hit about 30%. And now is, again, just follow the red line down, has dropped substantially. And then on the vaccine side, I think you know that we would like to see more people both get their initial vaccination and get the third shot. But this is what's happened in the state. And at this point, we still have a substantial population unvaccinated. So this is just sort of a picture showing where we are with the state. And you can see we have many who are unvaccinated. Now, some of those would be the under fives for whom there is no vaccine. We have a number of people who are booster eligible, but have not yet received their booster. And then those who are boosted. So we have, and then we have some people who have not yet hit that time window to get the third shot. So we as I'll show you, even though everyone is not vaccinated, in terms of immunity, we are doing well because so many people became infected with the Omicron variant. So just a quick look at some of the projections. And this comes, the modeling team has been meeting with the governor periodically. We used to meet weekly. Fortunately, a good sign. We no longer meet with the governor weekly, but probably every 2 weeks now to provide an update on where we think the pandemic is heading in the state. This is from the briefing on the 14th. And at that point, we were saying that we anticipate things will continue to go down. And they have, along with one of a fairly optimistic course we projected. At that point, there were still a lot of Coloradans who were infected. This is an estimate that's several weeks out of date. And I'm sure that probably 0.5% or less of Coloradans are infected because, as you'll see, most are immune right now. And there's a very high level of protection against severe disease because we all know there have been breakthrough infections. But fortunately, people who get a breakthrough infection, if they either had a prior infection or are vaccinated, they're very unlikely to become sufficiently ill to need a hospital. So the key things for the future really are how long our immunity holds up. And, you know, there's sort of a recent good news paper that maybe our cellular immunity will last quite some time. We know that our antibody levels against the virus fall over time. So really the key factors right now, the key unknowns are what will be the course of our waning immunity, and then what will happen. We think we can unfortunately anticipate that there will be more variants, and we will just have to wait and see. That said, I think as outlined here, we are entering into a very favorable period. We're in a very, very favorable period with regard to the pandemic. This is the projection I mentioned. So the black line is what has actually happened. Notice this goes back to July of last year. And the black line then, when we project forward, is falling right along this orange line, which is one of our scenarios where people sort of lighten up their behavior a bit, not as extreme as what's over here in the purple, for example. And we're following right along that line, which towards the end of the month and into March takes us down and towards levels that we really have not seen since going back to the summer of 2020 when we were coming out of that stay-at-home phase of pandemic control. Let me skip that, and I'm going to skip that. Oh, it's very interesting, and go on to this immunity modeling. So what I'm showing you here, and just look at the top line for the moment, that's the percentage of Coloradans who we estimate to be immune against an Omicron-like virus. And that includes those people who've been vaccinated, which is the lower orange line, and those who have naturally acquired immunity from infection. And that Omicron surge is why that greenish line, turquoise line, takes off so steeply, because so many people became infected. So this is estimated immunity to infection, and we're in good shape there, and even better shape in terms of the degree of protection against more severe disease. So I think that is the last of these. Let me stop sharing. And so in terms of where we are with the pandemic at the moment in Colorado, we're in a good place. We are in a good place nationally, and I think you all know that mask mandates have now been turned aside at all our counties, a somewhat mixed picture in the school. It's in the schools. It's almost 2 years, of course, since we abruptly went remote, and I think we had a remarkably successful transition with our educational system and maintaining educational offerings and maintaining operations. And I'm very appreciative of all the work that everyone did to make sure that things continued to function. For this academic year, at all campuses, classes have been in person. We delayed being in person on the Anschutz campus by several weeks, as you may know, because the Omicron surge was beginning to fall, but even though it was falling, the prevalence of infection, the rate of infection was still high, and we felt it was best to wait 2 weeks. And I think you can see that that curve fell very steeply once it began that downturn. The campus is a safe place in terms of infection. Everybody who is on the campus is vaccinated. If not, for whatever reasons, there's testing requirements and mask requirements. So I think in terms of where we are with the pandemic, as I've written, I wrote too optimistically in August, but now is a time to begin our transition back to being on campus. There are many reasons to return, but above all, we are school, we are community, and much of our work and interactions that happens when we're in person is important. Interactions with students, interactions among faculty and staff, and with students. So I think there's much to be gained for all of us by returning to a place, and we'll talk about transitioning, where we are more on campus. I mean, I will say I've been back a lot since in our new year. It takes a readjustment. You say, oh, it really does take time to get to work. And I drove from downtown today over here on still roughly unplowed streets, and I-70 was having yet another bad day. And, there are all those things that we've sort of, frankly, forgotten about. But we can make that transition. So I know we have a lot to talk about. So what I'm going to do is, I think, turn perhaps first to Christine and Kevin, and then on to Chris, and then we'll have a conversation with you. So let's see, Christine, do you want to?
Yes, good morning, everyone. I'm Christine Gillan. I'm the Associate Dean of Administration and Finance for the Colorado School of Public Health. Like many of the school's units, in our unit of finance, HR, and research administration, our team switched gears rather quickly and quickly learned that we were rather productive in a remote environment. So this is credit to our great team of invested employees who have great work commitment and work values. And I know that each of our unit leaders can say the same about their units. So 2 years into this pandemic, we're not looking to take a step back, but rather to maximize what we learned. So as a working mom of 3-year-old unvaccinated twins who are in daycare, I've had more weeks with life interruptions than I've had that haven't had interruptions. And with conversations with many of you, that focus has been your reality as well. So in my role as the Colorado School of Public Health, I have partnered with the Faculty Gender Equity Committee, the Faculty Senate, the Staff and PRA Council, the Total Health Committee, and our own Center for Health, Work, and Environment, along with our school's leadership. And our current focus is around employee survey findings that requested continued flexibility and life course support for our employees. So I just want to reassure everybody that a collaborative effort is underway to understand more completely about how to effectively and equitably operationalize these initiatives across all of our units. So for now, I will pass things off to Kevin Young, our HR director, who will highlight more about the university's policies, which we must abide by, and how the school has implemented those. So thank you.
Thanks, Christine. Hi, everybody. As the HR office for the school, we've been working over the last 2 years to support each of our units and our employees regarding the new remote work environment. I mean, we have shown that we can adapt to the pandemic and the ever-changing work environment to get our missions completed. And we've done that collectively, with the administrative units within inside the school, our leadership within inside our units, and our employees. We've all worked together to get this accomplished. And we've done it very well. I would say that there are some issues around mental health and the fact of being isolated within inside your own worlds that we still need to work through. But as a whole, I think as a school, we have done a very good job in that. If you remember last year, we were actually required to put remote work agreements into an online system, which was dictated by the CU system. This was really to record what we would be doing if we were now allowed to be back into the office. And that's come. We are now at that point where we can start to move back and transition into the workplace. And it is now another level of support that we have to provide to make that happen. As of today, we have about 275 applications or agreements inside that system out of 360 employees. So there's still some agreements that can be put in there if we still plan to work in that remote environment. Just to kind of give you an idea of what we've done over the last 2 years in recruitment, we have seen an increase of number of recruitment requests across all classifications, the faculty, the staff, the PRAs, and the students. We have increased our employee numbers by about 150 employees over the last 2 years. But with that being said, we've also lost 114 employees for numerous reasons. And so by saying that, we have a large group of employees out there that have never worked in our normal work environment. These are individuals that have only known a remote work environment. And so I think as we move to the next step and we take these challenges on to figure out how we get back to connecting with our coworkers and we transition into whatever this new work environment looks like, whether it's hybrid, fully remote, or whatever, it's our responsibility to make sure that we do that successfully and safely. So I just want everybody to realize that as a HR office inside our school, we are here to still support you in that transition. And that is everybody, our units, our leaders, and our employees as a whole. We are here to support you as we transition over. I will now pass it off to Chris Jones, who's our representative for the Staff Council, to provide some information on his side. Thank you.
Thanks, Kevin. And hello, everybody. I just want to say on behalf of the staff of PRA Council, to our leadership, thank you for involving us in this conversation. As you all know, this is a big group of people, and I'll just try and capture a few thoughts that have come up from council members and their perceptions on this return to work process, as well as some things that came up during our meeting yesterday to really advocate for change or measured change to my fellow panelists, as well as, let everyone on the call know what we're really going to try to bring to the conversation with everyone as things move forward. As Christine mentioned, there's still a lot of people with hesitations. The holidays weren't that long ago. There are people who still are getting over or just got over COVID. And return to work is something that's very, alarming and causes hesitancy. So, consideration around that and people dealing with long COVID or dealing with family members who have COVID and or have immunocompromised in children under 5 should be taken into account whenever possible. A great term came up yesterday, and I couldn't make this portion of the meeting, so kudos to whoever came up with it, but equity and flexibility. A lot of times blanket policies can impact staff and PRAs more than faculty, so we should really be considerate, especially with retention being something that's a growing issue. We don't want to lose more people to other options because they really prefer a full remote situation. A couple of things that, wish list items or, allowing, to Dean Salmon's point, maybe remote work during the commute so that people aren't sitting in traffic, allowing some flexibility around that. Understanding, life happens. So if I said Tuesday and Thursday was my day and my kids got sick, being okay with missing a Tuesday and coming in on Wednesday. And then really encouraging a culture of wellness, and encouraging sick time use. It's something that we really have to, help each other out and support each other, because I know we have a lot of workaholics and it can be easy to not do that. I know there's high sick time on many accounts, and we need to encourage each other to take that time. And I think overall, the flexibility issue is the key point. And a lot of staff and PRA members really said, not only is that important to us, but it also aligns with the school's goals and missions, especially with the commitment to mental health in life course situations. So know that the leadership is involving us in these discussions, and we appreciate that. I'm just a sounding board for many voices. And if you want to get involved in these things and, let us know your thoughts, please reach out. Please join us for our next meeting. And yeah, we look forward to the rest of the panel today. Thank you.
Okay, and thanks to everyone for your comments. I think just a few more, just sort of more mundane things to note. There will be food coming in the Fitzsimmons building, I think in mid-March is the estimate I heard from Christine, and the new building will also have food opening up sometime April or May. This campus has been quite the food desert, as those of you who have been here know. And so that is something that will be addressed. I think I know for many in parking and return to parking and what the parking options are is something that maybe something that some of you want to talk about. And Christine has looked into what may happen with different parking options. I will say, and Chris, back to you, and Christine, you may want to comment. I think we've tried to emphasize flexibility in our discussions about returning to to the campus. And there's not one of us who doesn't know that stuff happens, and that we have to be able to comment on it. And I think we've had so many Zoom meetings where somebody who might have been here was not, or whatever, and had the children parading through because they were home because daycare or schools were yet again closed. But Christine or Kevin, do you want to comment on just sort of the flexibility side?
Yeah, I think there's a lot of anxiety about filling out a remote work agreement that ties you to something set in stone. And I would just like to say that, no, this is your open communication with your supervisor. And it's also a form of accountability with your team, that your team members kind of deserve to know when you plan to work and what's being, when you plan to be there. But again, like I said, there hasn't been a week that's gone by that I haven't had an interruption. And I'm just thankful that my team members allow me the grace to navigate my life, and that I'm able to show up to work every day, do my job, accomplish my goals, and be available for my family when things get interrupted. So review the remote agreement as an opportunity to have a conversation with your supervisor and your team, and develop working relationships where there is that level of understanding amongst your team and your unit leaders about what they can expect from you, and when there are interruptions, how you plan to overcome that. So that would just be my 2 cents.
And maybe as a comment, I mean, these policies are not going to be sort of central, coming from the dean's office, but how the units work will come from the unit leaders. And I wonder, we have a number of center directors and chairs here. If any of you would like to comment about how you plan to approach transitioning within your own units.
Well, it's Lee here. I'm happy to add a few thoughts along these lines. And as most of you know, I direct the Center for Health, Work, and Environment. What we're dealing with here is it's actually bread and butter in our field of worker health and well-being. And our approach has been one that has really emphasized this whole concept of flexibility and a boosted level of communication. And that's something that has got to stay really front of mind, because at the end of the day, we need what we refer to as a workplace value proposition. What is the value of coming into work? And we have this telework paradox, right? You've heard about it. Part of it is that we can actually sometimes be more productive at home. But the flip side is boundaries get violated in both directions, right? That you've got, especially if you're a caregiver, you have responsibilities in the home that start to overlap with your work, and vice versa. So as we think about the work value proposition, it's really important to make sure that there's a compelling reason for people to come to work, overcoming social isolation. If you're a new employee, being able to engage with your coworkers and establish those relationships, these are things that are really valued to us. And so what we've been emphasizing in our return to work planning has been a lot of communication around what's going to work for individuals, discussing how do we adapt to the changes that are occurring around us even now. Understanding we're still in a period of evolution, and supporting each other as managers and as co-workers in making the shift. This is a time for extreme kindness and understanding of each other's situations. So those are things that we've been emphasizing. We do understand, and we have seen that working outside the office has boosted productivity by helping to eliminate commutes, allowing more focused individual work without distractions for some of us, and more distractions for others if we have caregiving responsibilities. It can actually benefit our well-being by giving each other as co-employees the ability to maybe save money on commutes and on parking, to exercise more often, pursue other interests, care for family members. and still get our work done. So we're trying to strike that balance. And it's not a simple equation. Probably the biggest thing I have to say today is that if you think one size will fit all in terms of return to work, throw that out. You know, we have to talk not about equality here, but actually equity. Different people at different times are going to need different accommodations.
So thanks, Lee. Do others want to comment? Other unit leaders? I'll take silence as a no, I guess. And next, and
I just wanted to say, I agree with what Lee said. I think that there is flexibility and equity is really important. And that requires conversation and communication.
great. And let me suggest that you put, I guess everybody has access to the chat, it looks like. So maybe perhaps put questions into the chat. I think, Kevin, there's a question from Sarah Miller. You can probably, she's adjunct, she would not need a remote work agreement if I.
Yeah, just to be clear, the remote work agreements are for employees that would normally be working 100% inside the office or on the campus. And so employees that do not have that requirement are now working remote, do not need to put that remote requirement or agreement inside the system. So as an adjunct, if you're not coming to campus on a normal regular basis, then you would probably need a work agreement. Hope that answers your question, Sarah. And I'd also like to just add a little bit to Lee's piece. Just from the HR side and the recruitment side, we're seeing a lack or a lower number of applicants applying for our jobs, because recruitment today, applicants out there are looking for more in a workplace, and flexibility is one of those top things that they're looking for. They're looking for remote work practices, flexibility, because they have been working in this environment for 2 years. So when you're thinking about recruiting new candidates into your positions, take that in mind, that those are the things that they're looking for now, that flexibility and remote work environments.
You know, I might comment on a few other things on the campus. So one, I think you all know from the communications from the Chancellor's office that we will be ending mask mandates on this campus the 28th, I guess, Monday the 28th. And again, I think that's a very reasonable thing to do with where the infection, where the epidemic is. I think for those who may want to protect themselves, as a reminder, and Lee, you can certainly comment here, that then what you want to do is get what CDC is calling a quote well-fitting mask, but in actuality is a respirator, and that would be an N95 or, you know, commonly available a KN95. And you know, again, my personal preference right now still has been, for example, if I'm out in public where, you know, you don't know what your infection risk might be, sometimes I will wear one of those if I'm in a densely occupied place. And certainly, for example, for air travel. But if you know, again, if the mask mandate is released on this campus, because it's really there to protect others from what people may be, you know, propelling out of their mouths and noses. But if you want to protect yourself, go to the N95 or KN95 option. But Lee, do you want to elaborate on that?
Yeah, no, I think that's right. I've got here, you know, I'm in the office. I've, you know, got my duck bill
Right.
at hand, and making sure that it fits you well. We've actually in our center stocked 3 different kinds of N95s, and people were able to, you know, grab some and use them, figure out which one works best for them to get the tightest fit, tightest seal, and we welcome them using them, you know, in the office if they feel that they still need that extra level of protection. We're going to move, John, into kind of an ambiguous period here, right? Where we're going to have people who are still, as someone was saying earlier, maybe uncomfortable returning to the workplace, but there will, starting next week, be those of us who are in the office feeling comfortable enough to not be using this in the office. But there may still be some of my coworkers, we have a shared space, some of my coworkers who want to keep wearing their masks, and I respect that. If people feel like that extra level of protection is what they need when they're around even people who are fully vaccinated like we are, immune like we are, if they want that extra level of protection, I encourage them to maintain that as a personal choice. So that's how we're kind of handling this transition period.
Sure, and I think again, those who make that choice, you have an option available. We did distribute, I think at this point, 1,500 KN95s to the departments, and there may be some of those available, and there's some extras from the original purchase still down here for those who may want them. Let me see. Again, please, for those of you who have questions or comments, please put them into the chat. I don't see anything going into the Q&A, but the chat seems to be working just fine.
Oh, John, this is Devashis. I was going to echo what people said on the panel about flexibility. Nicole and I can tell you that we've had several former faculty members in VNI and CETA that are working for Mayo Clinic in Minnesota, at UC of Utah, at Genentech in California, all while living in the Denver area. So there's a lot of attention being paid to flexibility. So that's an important thing going forward.
For sure,
Yeah.
and I think we will leave that as emphasized by all of us.
I think it is interesting if you look at what all the big corporate consultant groups like Gallup and McKinsey and some of these other organizations are doing. There are two things that they're talking about now. One is this issue about having flexibility and high communication, regardless of what the business is, and then the second part that they're really emphasizing is well-being. I've never heard the word well-being. For those of us who have been studying well-being, it's kind of amazing to see how that seems to be the buzzword for this year. And so doing the kinds of check-ins that give you an idea about how things are going with your coworkers is really important.
Well, let's see. Let's wait a minute or two more for any thoughts to accumulate in the chat. I will say that one thing about being in is that I'll have people stop me in the hall and say hello or introduce themselves as new employees, and that's been actually really really nice. And I think wandering around the halls and finding their people in their office and say hello, it's a great reminder of what we do miss, because you just don't do exactly the same thing. And somehow, we've all gotten used to seeing people in small squares on a computer screen, but certainly better in person for many kinds of interactions. So I don't see anything accumulating. Let me just see a last round for those who are here. Let's see, handle remote folks. Yeah, so now that's a great question. These, I think we'll have to sort out this sort of hybrid world. And we have, on the third floor, a number of rooms that are equipped to handle both in-person and remote, the so-called teleconference room or the Dean's conference room. Lee, I suspect you have that capability, and your office is up on the fourth floor. But I think, a question of sort of being better able to handle remote hybrid, use the word hybrid meetings is something that I think we probably want to look at and see if we have an opportunity to up that capability. We've had some of the deans and chairs meetings, the executive council meeting with a few people in the room and many more on the screen. And it's not exactly fluid yet. I think we're not used to that. I mean, unfortunately, over the last 2 years, it's become part of our, new capacity to have a meeting where we're little squares on a computer screen. But I think in terms of looking at our capability to handle things remotely and whether we need some equipment upgrades, which I know we do in some spots, would be something to think about. I'll see if Christine, I don't know if you have any comment on this at all, but we don't have that. We probably don't have enough capability, I think is a fair way to say it.
Yeah, I think again, patience, as one of our panelists said, we just need to work out the kinks with this. And then if we need to upgrade our systems, we're more than willing to do that.
It's been, even before this pandemic, it was clumsy and awkward to use our conference rooms when you had some people who were remote and some people were there, right? Like you see people in a room, if you're listening in, it's an echo, and you see these little tiny people because you have one camera for the entire room. And I haven't found on this university campus yet really elegant solutions to that. One thing that we're going to be experimenting with more is when we're going to be in a room together, we may actually all bring our laptops with us, pop them open. So those who are remote can actually see us. We're going to put our microphones on mute, so there's only one going and not echoing, but you'll at least be able to see someone's face instead of being this microscopic person around a long table. We're going to have to be clever, I think, in solving this.
Yeah, no, for sure. I gave a progress report to a committee of the state legislature last week, and I saw these little tiny figures off in the distance, and couldn't tell one from another. It was very awkward technology. Let's see. Yeah. There's a comment from Heather Kennedy, and comment about the rise in inflation, where we are, raises, and the additional costs of coming in. And of course, with what's going on over the last few days and what may come, it's hard to know what fuel prices are going to do, but any scenario that I can think of probably has them rising, among other prices, other things that may rise. I mean, we'll just have to see what comes. I think we're cognizant of this. I think, Christine, I don't know whether you want to comment. I mean, on sort of where we stand with what could happen with salary increases at the next, when they're possible again with the next fiscal year.
Yeah, Anschutz is moving forward with recommendations for 2 separate pools, one for merit and one for market and compression. Those need to be approved by the regents, and that meeting happens in April. So we will move forward assuming a 3% merit pool for July 1. And then as we learn more about a compression pool or a market pool, we'll be able to, figure out how to implement that within the school. But it's not my understanding that that would be July 1 as well.
Yeah, and I think, what can we all say about the global situation, except we're likely to face any number of potential shocks, whether financial or otherwise. And, I think that today is full of unknowns. There's a question that came in, thanks, Lee, for finding it, about special circumstance like working in cubicles or shared open workspaces. So I'll comment, and others may want to comment. I mean, I think, we feel that it's safe to reopen now because the rate of infection is very, very low, and it's going to get lower. And what that means is that there's, I think, for the moment, and again, things will change, but there's, I think, a low likelihood that your coworker is going to be infected and infectious sitting next to you, whether it's in the adjacent cubicle or in an open work area. I think if, as we said before, if you are concerned about assuring that you're at the lowest level of risk possible, then wear a KN95 or a N95 respirator and to provide that protection. There was discussion, and I think it was the last time we got together and talked about the issue and had a town hall about the ventilation systems in the various in our various buildings. And we know from campus facilities and discussion that the ventilation systems have been looked at to ensure that they are operating as they should be. So, I think, again, I would just say that here's where, if you are concerned about your risk because you're not perhaps in a private office or one that's shared with a small number of people and in an open space, there are things you can do. Then that said, I think, the open space with sort of, good air turnover may be a better environment than an office with a closed door and a fellow occupant. So those spaces should be well ventilated, and particularly in some of our newer open areas. I think, hopefully the ventilation systems, when they were redone, represented what they are doing, what they should be doing in terms of air handling. And again, Lee, you may have comments on this as well.
Yeah, the micro environments that we have overall all around our buildings, are going to be a little different. So in an office, as John had said, it might be different than is an open space. The last time I looked at the data for this campus, they have installed the high efficiency filters on these buildings. They have amped up the ventilation. For those of you who are in an office, I'm actually cold right now. I'm never cold, but part of it is that there's a much higher air exchange rate than we've had in the past. So I feel like those things are being tackled pretty well. And again, that's just one part of the panoply of resources that we have to keep ourselves protected. Staying home if you're sick, if you think you've been exposed, if your kid got exposed, doing the things that protect others in the workplace, wearing a mask when it's appropriate. There's still guidance around that. Plus having improved ventilation and having the immunity that we have, the sum of those things is what's protecting us. So I feel like on the ventilation side, that's been reasonably well addressed to the extent that it can be addressed in most of our workspaces.
I mean, one other comment, somewhat belatedly, rapid test kits are now available. Again, a bit late, but that's another thing if you're sick, and they're not perfect, and hopefully they'll get better. And they have this sensitivity problem because negative does not mean that you may not be in fact positive if tested by PCR, but that's an issue. I see Michelle has a question about climate, our carbon footprint. Just a comment here. I'm actually co-chairing a task force for the Association of Schools and Programs in Public Health, which is our school organization. And the task force is on climate change in schools of public health and programs and what we should be doing. And, part of what we think should be doing is trying to be leaders and exemplars around, mitigation of climate change. Certainly our carbon footprint has dropped around transportation because we've been coming in very, very little. And I think, with some return to work, you're right. We will be burning some fuel to get here. We can look at how much our carbon footprint is actually reduced because we do have people working flexibly and not coming in on a daily basis as many of us used to do. And I will actually say that and unfortunately public transportation to this campus is not what it was before the pandemic. I think the R line, which used to be part of how I got here, is running every half hour now, I think, instead of every 15 minutes. And the 15 bus doesn't come onto campus anymore as it used to. So the public transportation options are not as robust as they were before, unfortunately. And if you read about sort of RTD coming back, it looks like it's going to be a very long road before it heads back to the level of service it used to provide. Let's see, Chris, universally low parking charges. Yeah, Christine, I think Christine does not set parking charges, by the way. So let me just make that clear. But she does talk to those folks who do. And, again, the question of whether there are options to be developed that will sort of meet needs of everyone as we come back for those who commute. And I think information there would be helpful. But Christine, do you want to comment on this?
Yeah, we're couple of points. The parking fees are an auxiliary, so they essentially pay for the maintenance of the lots that we park in, the parking garages, etc. So they don't make a profit, they just pay for the maintenance of those services. But we are in conversations with the Vice Chancellor of Facilities, Jay Campbell, to discuss what is the appropriate breakdown of what's a part-time pass or a full-time pass, and where does that line get drawn? And he's open to monitoring passes and understanding use more so that he can pay for the services that he needs to pay for to run his operation, while not overcharging. The other thing too, just remember, so the way the university budget model works is, yeah, I'm sure they could offer free parking, but then the school will get a bill to offset those costs. So yes, maybe the school could pick up that bill from a school standpoint perspective with state dollars, so employees wouldn't have to pay, but it has to get paid some way. So there is also a committee that is working on retention, and that is, we have Erin Poole on there, Eric Brodell, Nathifa Miller, Cerise Hunt, and Kevin Young, all looking at retention options. And this is a great idea to kind of forge forward and work with Central Anschutz to say, this might be a way to incentivize. Have you thought about this? Are there other funding sources that we can put towards parking? So we will add it as a consideration of an idea that's been suggested. And I do know that Kevin sits on the University Staff Council, and this has definitely been brought up in the past and escalated. And so we'll continue to have, you have my promise that we'll continue to have those conversations. So.
Thank you. And I didn't mean to jump in front of, just so it doesn't get lost too. Betsy asked a question, which maybe this is for Kevin. Is there a particular time frame during which updating the remote agreements put in place is needed, i.e. do they expire at some point?
Thanks, Chris. The answer to that is I think we just had the same question at our last EC meeting, where when is a good time to update your flex agreements? We realized that the tail end of last year is when these agreements were supposed to be put in place. And that's what most people were thinking at that time. I think that we are open to having any flex agreements updated at any time, especially when you have changes or you've modified what your plan is going to be. So feel free to send in or submit a new flex place agreement or a remote agreement, and we'll take care of it and make sure it's processed. So thanks.
And I will say that, and particularly as the units sort of come up with how they're approaching transition and, whether agreements, I mean, look, when we all filled those papers out, it was a different world at the time. And it keeps changing, obviously. And so certainly to revisit. And let's see. Christine, do you see the comment from Catherine? Another.
Yeah, so actually, Catherine's point, yes, this was brought up by University Staff Council a number of years ago to have levels or bars or ranges, and people would pay according to their salary range. And Kevin, I don't know, you were at those meetings. Did that get any momentum? I know it has been suggested previously.
Yeah, the University Staff Council brought this up to Terry Crothers and Jay Campbell and that leadership group to see what options that we had. And we proposed several different options as far as tiering levels, reducing parking for certain employees that may have lower salaries versus individuals that may be at a higher level. It really did come back down to the fact of what facilities has to pay for those parking spaces. And so we didn't see too much traction except for the fact that they were going to look at how they increase salary with the increased parking fees over the years. But I would say that they're being more flexible today than they were back then because of the fact of knowing that most people were working in a remote environment. So I think that with discussions still going on, I think that we may see more flexibility, but Staff Council had that conversation a couple of years. We could definitely bring that back to the table. If there's a real, I would not say a real need, but we could definitely take that back to the table if we had to.
Yeah, and I think there is a commitment, like I said, from university leadership to look at this. Jay Campbell, he needs data to drive his results. So he said he can't really back into the number that he needs to get to run his operations without people coming to campus. So it's kind of this, once we start coming, then he'll have data about his costs and usage, and he's definitely willing to monitor this on a continual basis to find the right mix.
Okay, I'm just looking through the comments here to Sarah Miller on sort of what the balance of classroom instruction, hybrid, remote, in person. There's an awful lot of discussion going on now at the school about shaping our remote or distance educational offerings. So, and that's in part because at the university level and now the campus level, there have just been enormous changes in sort of the infrastructure and the approach to providing distance education. So on that, I would just say, stay tuned. What was the university level Office of Distance Education, ODE, is now no longer, and things have reverted back to the campus. So I'll just stay tuned. I think Sarah Trimmer, the question about capping the number of remote days that can be requested, I don't think that a cap per se has been discussed. I mean, I think we've talked about flexibility. We need to abide by university policies and how units intend to carry out their business. But Kevin, do you have a comment about that? Or
I agree. There's not a cap per se as far as what the remote agreements are there for. But if we think of what the concept of remote work flexibility is to allow individuals to work in a remote environment versus having 5 days a week inside the office. There is another process that's out there for CU, which is actually called the Flex Place Agreements, which is geared to those individuals that are employees of CU that actually work in remote locations where they cannot be on campus or be in an office, CU office. So those are the two types of agreements out there. We would probably suggest that these are agreements that are based upon the business needs and the missions. And if an employee can spend, 3 to 4 days remotely and come in 1 day a week, that's a business call, I think, not a requirement. But if you go 5 days a week, you're basically saying somebody is in a fully remote work environment, and a flex place agreement should probably be put in place.
yeah, Nicole.
We also, so we didn't put a cap, but we're very space crunched, and you can imagine as we go back that we talked to the group about, if you want to work in the office 3 days a week, you can keep a desk, but if you want to work in the office 2 days a week, you might need to share that desk. And so that's giving them an opportunity to think about what's valuable for them in their workplace. And so we didn't cap it, but there are issues if you allow a ton of flexibility and then you're running out of space and you have a desk unoccupied 4 days a week. So that the group actually was great, and in their discussion. And some people, the desk isn't that important. And other people were like, yeah, sure, I'll come in 3 days a week if it means I get my own space.
I mean, I will say there are a number of other comments, Megan and Michelle and others. I mean, I think the key here is that units will work with the folks within the units on how things should go in ways that work best for the unit as a collective, and then for the individuals making up the unit. I think that's where flexibility is the critical word.
If I can just chime in here for a moment, John.
Sure.
I think that as people are working through, and this is not the first time that we've had people, what has been called telework, which sounds quaint now, but it's called telework. There are a couple of things that you should be keeping in mind when managers and staff and colleagues are deciding how and when to do it. First is to think about what is the nature of the work. Is the design of the job something that's conducive to telework? For those of us who engage with students, that's going to be different than somebody who's maybe doing purely research or where their research is actually out in the field. The second thing is to have policies, and we've talked about this already. How do we schedule it? How do we communicate about it? How do we stay flexible and also adapt? The third is to figure out what are our most effective communication tools to get our work done and also to maintain connectedness. And then the fourth thing in the equation is boundary management, which I just have to emphasize, which is understanding how for an individual and for a unit, do we come to some agreement on how to maintain the work-related expectations, but at the same time protect our off-work hours. So those are the four things that need to go into this. The last thing I'll add is for those of us who are going to continue to have a proportion of our time working from home, making sure that we've thought through the resources and support so that our home workstations are safe. Are they ergonomically correct? Do we have protection from the injuries that come from repetitive motion by having a desk set up appropriately? So those kinds of issues, I think, are also worth bearing in mind as we have these discussions. Even 2 years in, I see people on Zoom calls where I'm going like, that is not an ergonomically acceptable setup that you're using, and we need to have that safety issue addressed at home as well as at work now if we're going to continue to do a hybrid.
Okay, and any comment on the query from Caitlin?
Sorry, I guess I can answer that. I was just trying to find it in the chat. Changing policies for expense reports regarding work travel, 100% work remote can start travel from their homes and get reimbursed. Yeah, so now that travel is opened up and rooms are at capacity, we are expecting more events, normal life, etc., to start, on February 28th. And I will have to revisit policies around that, and we will get those out to units. But the guidance on when travel and mileage can start based on your home work location comes from the Procurement Service Center and in the CU system office. So we'll just check. It's been a while since we've all been getting reimbursed for this and moving within the state. And so let me just get some clarification from that. We can address this at the staff meeting and get information to executive council members about what the policies are currently in place around that.
And Christine, do you see Bobby's query about childcare? You've perhaps been following that most closely in the care.com story.
Oh yeah, so I personally tried to use care.com backup care and I was denied. So I totally understand that the university's mechanism, while it is helpful and there and has been utilized and is convenient for many, is not always a tool that helps. And I did give that feedback back to the care.com team that, telling a mother at 8 p.m. the night before that she doesn't have care the next day when she requested it a week ago does not leave me able to manage my work duties. And so how can this be a work benefit? But there are employees on campus who have been very vocal about childcare needs, and the university is listening. So please know that Anschutz is looking into brick and mortar childcare options, increased capabilities on campus. Now, is this building going to be built tomorrow? No. So what we all need to do is collectively have a voice to advocate for this. They are listening. They know it will cost a lot of dollars. Will it be subsidized? I'm not sure. Will it be convenient? Most definitely. And there's also news that it's interesting to Bobby's statement, or Bobby speaking on behalf of whomever, about the age differences. So what Anschutz campus is seeing is that there's an infant need. That mothers with infants want their children close and don't, have options, but they're not seeing a need for toddler and above. So if Anschutz knows this, they'll design rooms that accommodate infants and won't have these breakout spaces for 5-year-olds that can fit 30 kids in a room. So I would just, I can be your liaison to campus and express those opinions, and they are listening and coming up with next steps. So so school age children, again, express all those opinions to me of all the age children's and all the issues, and we can come up. I don't know if it's an after school program or busing systems. I don't really know, but let me know what needs to be voiced, and they are listening. Yes, they do realize that there's a life cycle here, and they are using as much healthcare benefit options to project the number of children that will be born within the next 10 to 20 years based on child rates at this time. So, I mean, yes, they do realize that these kids, but they also know that kids go to school mostly in their own counties, and that they actually haven't seen a lot of interest in the composite school that is located right here on campus. So again, I think they're taking that data of, we did put a school here on this campus, we opened it to everybody, and enrollment is not great. And I don't know, obviously there was a pandemic in the middle of that. So again, they're listening. If you would like your voice to be heard, emailed me. Unit leaders, please collect this data in a systemic way within your units, and I can bring it up the chain. But the need is known and solutions are being created. So this is wonderful for working parents and caregivers.
And this is a real change in the approach from saying no brick and mortar to what do we do? So I think that needs to be acknowledged. Let's see, Peter put an answer in about mileage. And I think, yes, teenagers are different. We know that. Thanks, Michelle. And let's see if there are any other last comments or questions. I want to thank, we've had over 100 people on throughout this discussion. I want to thank you for joining, but any last questions, comments from anybody?
Just a final comment on behalf of the staff council, PRAs. I know there's a lot of anxiety and a lot of concerns, but to close out a little bit of a positive note too, we had a number of staff members share that, they've been coming in and do feel safe and are excited to see their coworkers. And that I think we can find a way forward that caters to all the different situations and life courses under our umbrella. And also that we appreciate the school's leadership, because a lot of schools on campus and entities are not giving the same leeway and input. A lot of folks, it's been a hard top down, you're back in. So I think this is a process that is emblematic of this school and the people who work here. And we look forward to seeing how it plays out and being a part of it. So thank you again.
Thanks. Thanks, Chris, for the nice comments. And I think if everybody, just let me look across the screen, see if anybody else wants to comment or weigh in. And if not, thanks all for participating on, I think, an important discussion, and I look forward to seeing you here and stopping and chatting in the hallway. You can come walk on the new carpet, which has remained remarkably pristine because we've had very few people walking on it. The dean's office still has a huge supply of spill-proof coffee mugs for you if you want to drop by and pick one up. And we'll definitely think about some events and where there's an opportunity for us to get together face to face over coffee or food or something. So again, thanks for all, and I look forward to seeing you, and let's hope that we see world peace return. Thanks. Bye.